Good day, everyone. My name is Dr. Ori Goods, and I'm a research fellow at the Urban Observatory. Um, and I was asked today to deliver a short presentation that is focused about GIS and some of the spatial analysis technique that actually underlines a lot of what you've seen in the last few days within the RMIT Urban Observatory. So I know you actually learned on the last few days, and you've probably seen a lot of examples of outputs that being underlined by GIS technology. But I want to use maybe the next 10, 15, 20 minutes to discuss a little bit about the techniques that underline, that enable that, and how the outputs look like, what enabled them, and also some of the potential other data sources that we can use to expand and enrich some of the outputs. So, in terms of the overview today, we'll first start with a bit of definition of GIS. We'll continue into discussing what is spatial analysis, and we'll define that. Uh, I'll then provide some spatial data analysis techniques examples that is related directly to your context, which is health and livability. We'll discuss a little bit about what are the type of domains or examples of domains in which decision making can be assisted by using GIS. Um, I'll show some examples of how spatial data analysis can be used in health planning and policy making, uh, particular in health inequalities and spatial analysis. Um, we'll also show you some other options to where data could be obtained, um, especially from New South Wales. And we'll have a bit of a short summary and discussion. So, overall, the context of this presentation is spatial data analysis for health and well-being planning in urban observatories, and obviously, this is derived by one of the objectives of this intense course. You've probably seen a lot of examples and screenshots from the Urban Observatory, but just quick one, you can see here a dual map, or what we called in the GIS jargon a bivariate map. On the left side, we can see the health social infrastructure layer, and the right side on the livability index, and they both focus on the area of Bendigo. So having this type of analysis of this type of bivariate maps really help to compare between two variables or two indices. So we'll start with a bit of a definition of GIS, as mentioned. So GIS, a Geographic Information Systems, is a computer-based system designed to capture, store, manipulate, analyze, and visualize geographic or spatial data. It combines hardware, software, data, and analytical methods to manage and display geographically referenced information. GS allow for the collection, integration, and interpretation of different types of spatial data, enabling user to view, query, and analyze information in a geospatial context. Now let's dive a little bit deeper and discuss more about spatial analysis. So, by definition, spatial analysis refer to the process of examining, modeling, and interpreting patterns and relationships within spatial data. It involves applying statistical, mathematical, and computational techniques to explore geographic patterns, distributions, and interactions. Spatial analysis in understanding the spatial variation of a phenomena, identifying spatial trends, detecting spatial clusters, for instance, or hotspot, and making informed decisions based on spatial relationships. It provides insight into geographic context of data and facilitate the discovery of meaningful patterns and trends in relation to specific geographic location. And in the next few slides, I will show you some examples that derive by or different techniques of spatial analysis techniques, methods, or tools that often are being used within government, with research, and so on. But before diving into some of the techniques, I thought it would be useful to just maybe list some of the domains of decision making in which GIS can assist. And by all means, this is not exhaustive list, but some example of how GIS can help us. So for instance, we can look on the demand, let's say the demands of patient for healthcare location, the supply, when in this case, the layer or the GIS layer in this sense will be, let's say, a location of GPs or health clinics. Another domain is essentially demand versus supply. So I can overlay both of these layers. Let's say there's demand by patients in an area versus the supply, how many, let's say, the GP ratio or the distance on that particular location. So I understand how accessible they are to health facilities, as an example. Accessibility is a big, a broad topic, because accessibility could be a distance-based accessibility, it could be a financial driven accessibility, and so on. In this sense, or in the context of today's presentation, we mostly are referring to a distance or proximity into, let's say, health facility as an example. Utilization is another domain, and distribution as well. An example for that, let's say we analyze some kind of a city. Let's say we look on Perth and want to understand where nurses and doctors are actually living, and whether they actually close enough in a case of emergency to the nearest hospital in which they may be employed. That would be an example of that. So now that we better understand some of the different domains in which GIS can support or assist in decision making, let's maybe look on some spatial data analysis techniques in which we can actually use it. So we have here a list, spatial mapping and data visualization. We actually seen it a lot during the COVID. There's been extensive use of GIS and dashboards, map stories, web maps. Obviously, that's really helped to democratize the use of GIS in health. Spatial clustering and hotspot, I have a specific example for it here. Spatial interpolation and modeling, spatial temporal analysis. Data not necessarily just have to be spatial, but also can include a temporal aspect. And network analysis. This list actually is longer, but I just pick some of the main ones that I often see in research as well in government practice, in which I'm involved, I guess, in both. We can see here in the diagram, or on the right side, we can see a lot of points, driven data, but it doesn't actually make any sense when we run some kind of a hotspot analysis. In this case, we see the output as a grid cells. The grid cells represent some kind of distance, and we can see area which is red, area which is kind of shaded blue, and that refer to hotspot areas and cold spot, which are both actually of interest. We can look on some other GIS techniques, as mentioned earlier, network analysis, multi-criteria decision analysis. This is often when we need to include different criteria or different variable to understand where a potential location, let's say, where would I actually plan a new hospital? I might want to actually include different layers and different parameters to consider that. We'll often use what we call multi-criteria analysis. Different ways to do an interpolation of data, and so on. Before I'm going into more specific example about accessibility, I want to clarify one concept that is related to distance. So often we hear about the term or the terminology of network distance versus Euclidean distance. So you can see here in the diagram on the left side, this is a buffer of 500 meters. I might use my red pen around here that shows this is like a 500 meters as the crow flies over the streets. But people in reality do not fly over the streets. We actually walk. We use the network, the roads of the city to actually walk. So using modeling based on that kind of analysis, that kind of distance may not be really correct to do so. And this is where GIS has evolved and used what we call network distance. And you can see that the 500 meters from the same location in the right side is essentially very different. We see some kind of a polygon rather than a circle. And that includes all the streets because that take in consideration all the roads and streets that are falling within the 500 meter threshold. So all the segments or part of the segment beyond this dashed line, they are beyond the 500-meter network. So using or understanding that concept really kind of helping us to model it more correctly as we use as a pedestrian using the road network as well as cyclists, as well as car. If I do it for cars, there's obviously different rules and topologies that can be applied. So we need to understand that concept first. Other techniques that I've mentioned on earlier slides were cluster analyses, and I think that diagram showed or tell the story quite nicely. We can see on the left side that what we call a low cluster, things that the different colors are a bit kind of played or portrayed in a randomized way. As I go towards the right side, it become more cluster. I can see more green on this area. I can see more purple on that area, and so on. So this type of diagram shows whether, obviously, we can apply it geographically, whether area is actually is considered as random or low cluster, whether it's a high cluster output or in its characteristics. Other techniques that often used both in research and government is what we call spatial temporal analysis. This is a really nice example that belongs to one of my master students in UniSW, where he actually used 10 years of data of bushfire data around New South Wales, and he was analyzing based on each year. You can see the diagram, it's starting from 2011, goes all the way into 2020, and we have different colors show how the hotspot or the cold spot of bushfire essentially move or transition over the years. So adding the temporal aspect or dimension is very important to understand how terrain change over time. So GIS or spatial analysis is not just consider spatial pattern, but also spatial and temporal patterns, and understanding both of them giving us often give us better insights. Now, I included here a few screenshots from the Australian Urban Observatory, which you've probably seen for the last few days, but I thought they will kind of put things in a bit more context, contextualize this discussion. So example of how spatial data analysis can be used in health planning and policy making. So identifying areas with higher prevalence of health issues, for instance, assessing spatial accessibility to healthcare facilities, to supermarket, or even fast food outlets. As an example, recently in the Urban Observatory, both Alan Both and myself developed an index that based on a distance, the nearest distance to the fast food outlets. We update this on a 12 most major fast food outlets across all the 21 cities across all Australia. So it's probably the most comprehensive one that's ever been done. And it gives us good idea which communities have better or less access to supermarket, which is important, also has some implication for the type of food they eat, or which maybe communities have more access to fast food outlet, which can actually lead to negative impact, such as diabetes, chronic disease, higher BMI, and so on. Other aspect or other things here mentioned in the slides: analyzing environmental factors influencing health outcomes, exploring social determinants of health at a neighborhood level. Actually, in the case of the Urban Observatory, we have both the LGA, the local government level, the neighborhood level, or what we call the suburb, and actually smaller one, which is the SA1, statistical area one. So obviously the layers and the different colors here in this example showing you average distance to the closest fast food outlet in Melbourne. The more red color or purple color, this means more, I guess, more access to fast food outlet. As we go outside, it's obviously it decreases as we go into less urban areas. But we can see a bit of a tendency towards west or northwest of Melbourne, in exception the farther area around here. I must say, by the way, that in Sydney the trend is quite similar. So in kind of west part of Sydney, you will see, I guess, higher access to fast food outlets, and I don't think that this pattern is random from various reasons. Other case study that I prepared here is spatial data analysis for walkability. So description of another case study utilizing spatial data. We discuss about accessibility. I think in this case, we were using, again, an example from walkability for transport index, and not surprisingly, areas that are closer to Melbourne CBD and the first or second tier around having better access to transport. As you go farther away into the more suburban areas, the more semi-rural areas, the accessibility is being reduced quite substantially. And maybe if we measure, then car dependency is probably rising in accordance to that. Obviously, this analysis is underlined by accessibility analysis, which is one of the special techniques that I mentioned, and by GIS data. And obviously, we incorporated this into the Urban Observatory to show that. The same apply for health inequalities and spatial analysis. I guess in this sense, it's quite important to consider different socio-economical factors. In Australia, we often use the CEFA index, which I'm sure you are now familiar quite well with that. This is, by the way, an example from Sydney. So you can see on the right side the livability index, and you can see it's much higher in the eastern sides or the kind of inner west of Sydney. As we're going toward west and farther west or northwest of Sydney, which is also an area with lower level of CEFA score, I guess communities that are more disadvantaged in a way. You can also see that their access to health social infrastructure is accordingly also, I guess, lower as well. So by all means, this is not surprise, but when we do this type of analysis, which is directly underlined by GIS and spatial analysis techniques, we can get really clear evidence for that. And this evidence can then be translated into helping decision maker to maybe distribute some of the social infrastructure facilities in a better way, maybe some of the healthcare centers and other resources that the communities may need to be. So this is actually critical information that the Urban Observatory showing or presenting that could really help to make it more equal on the longer, obviously on the longer term. Other things, and I would ask Melanie to, because this is a recorded video, I will ask Melanie to show this video. As I may have mentioned, I also wear another hat. I'm the Geospatial Analysis Manager within the Advanced Analytic Insight Division in Transport New South Wales. One of the kind of flagship project that we were involved in is creating the built environment dataset, which is also called Movement and Place Framework at Transport New South Wales. And if Melanie can display this movie, it tells a little bit of some of the built environment indicators that have been collected within Transport New South Wales and been very helpful for internally, and now will go also externally to, I guess, provide evidence and GIS data that can then be used and analyzed by different partners. I also included the source to where it is, and there will be also an option to download this data in the future. So a bit of a summary and discussion, I guess some additional question to ask as well. So spatial data analysis can inform urban planning decision to improve health and well-being. How findings from spatial data analysis can be integrated into urban design. That's something that we as, I guess, urban planners needs to ask ourselves and take this to the next step. This is exactly where we can apply and to do the translation. So use this spatial data, the GIS that we are using, and then bring some of the insight into offer communities better urban design, streets that are more, let's say, pedestrian focused rather than car, or maybe using some street in a dual manner. Let's say in the morning it's open for cars, but in the evening it's becomes like a street that there's only a restaurant and there's no car entry into this zone. So a lot of good example from Europe, as well as Melbourne, a few in Sydney as well. Transportation planning and the allocation of health resources. So the intersection between transport and health is obviously important. So we need to understand our health resources, the access to health facilities. We obviously need to ensure that most of our communities have good access with public transport, as well as with using active transport modes, cycling and walking. And you probably been hearing a lot about the 30 minutes, the 20 minutes, and the 15 minutes project elsewhere. Some nice example in Barcelona, in Melbourne, the 20-minute cities, and in Sydney, the 15-minute cities project, which is also something under work now, led by Transport New South Wales. Emphasis on the importance of spatial data analysis in understanding health association and variation with cities. So I think this is one of the objective of the course, but I think when you see some of this example, it makes it much more tangible. Okay, we need to use spatial data. We need to use some smart and intelligent analysis technique to understand this association and make decisions that are informed. So I think only when you see this type of maps and beautiful screenshot, and I know that Melanie and maybe others show you in the previous days, you really get this and it makes sense. I also included some additional resources for GIS data. So a few websites which I encourage you all to visit, like Orin, which is a portal that initially was developed for urban researchers. The SEED portal, which is an environmental portal developed by DPI, Department of Planning and Environmental in New South Wales. A lot of environmental data set there. Movement and Place, which I discussed earlier. The national maps. Another really great project, which I really encourage you to have a look, is the New South Wales Digital Twin project. And there's a couple of videos there, so spend some time maybe in the evening and have a look on that. It will give you a bit of more enthusiasm and maybe motivation to maybe learn more about GIS, more about spatial analysis techniques, and maybe bring it into your profession, maybe into even your research projects. And lastly, some references. And feel free to send me an email or any question that you may have. You may be encouraged to do more work or to learn more about GIS, and hopefully that was useful. Thank you very much, and enjoy the rest of your course.